There are three important characteristics, and if our chest pain has these three, the likelihood that it's actually from the heart increases significantly. Only 10% of patients who come in with chest pain actually have a heart attack or blocked coronary arteries as the cause. First, the location of the pain. If the pain is located exactly behind the breastbone in the chest, the likelihood increases. Second, pain that increases with physical activity or movement. And third, pain that goes away and is relieved by resting or sitting down. If the pain you are experiencing has all three of these characteristics, the likelihood that it is coming from your heart and coronary arteries is over 80%. But if it has none of these features, the probability is less than 10%. Therefore, the quality and nature of the pain you feel is extremely helpful for us to determine what the cause is. In addition to these, there are some other findings that are helpful, the most important of which are the patient's age and gender. Heart attacks and coronary artery blockages are more common in men and are seen in middle-aged individuals and older. Therefore, if a young woman, for example in her 20s or 30s, comes in with chest pain, the likelihood that it is heart-related is very, very low. And conversely, if a middle-aged or older man comes in with chest pain, especially if he has those three characteristics, that is, the pain is felt behind the breastbone, gets worse with physical activity, and goes away with rest. There is a very high probability, over 80%, that it is due to blocked heart arteries. And this is someone who absolutely must see a cardiologist very quickly, and the cardiologist should perform an angiography for them as soon as possible. There are also other risk factors whose presence helps in diagnosing heart disease. Patients who smoke, those with high blood sugar, high cholesterol, high blood pressure, physical inactivity, or abdominal obesity. If these people experience pain, the likelihood that the pain is coming from their heart is much higher than in those who do not have these risk factors. The cardiologist puts together all these symptoms, findings, and risk factors to reach a conclusion about whether your pain is heart-related or has other causes, and based on that decides whether you should undergo angiography or be prescribed medication and sent home.